Hello, I'm Esme Murphy, and welcome to Talking Points. For more than 5 years, the government and doctors have drilled it into us. Getting the COVID vaccine could not only save your life, getting it could help protect your family's lives. The official Centers for Disease Control and Prevention recommendations as late as June of 2025 was that all Americans 6 months and older should get the vaccine, but not anymore. Under President Trump's Secretary of Health and Human Services, Robert F. Kennedy Jr., the recommendations have changed dramatically. The CDC now recommends the vaccines for people 65 and over and for people 5 to 64 with at least one underlying condition that increases their risk of severe COVID. So where does that leave you if you would still like to get the vaccine? On a 50,000 member Facebook group that was created in the early days of COVID called Minneapolis Vaccine Hunters, people are writing in that their appointments at local pharmacies have been canceled because of the new CDC guidelines. Others write they were told they could not get the shot, but that because of the new CDC recommendations, insurance wouldn't pay for it. GoodRx estimates the cost of the vaccine without insurance is over $200. Enter Governor Tim Walz, who through an executive order has given the Minnesota Department of Health until September 24th to find all ways possible for Minnesotans to continue to have access to the vaccine and to make public guidelines that all Minnesotans, doctors and pharmacists and patients will be aware of. The governor is also asking the health department to work with insurers to limit the cost of the vaccines. Joining us is the person whose job it is to sort all this out, the commissioner of the Minnesota Department of Health, Dr. Brooke Cunningham, who is herself a medical doctor and an assistant professor of family medicine at the University of Minnesota. Thank you so much for your time. We really appreciate it.
Thank you for having me.
All right. A lot of people are really confused, Dr. Cunningham. I know that you're supposed to come out by the 24th with guidelines and recommendations. Let me just first ask you, the guidelines changed so abruptly. Has the medicine, the science changed at all, or is it just the guidelines that have changed?
No, it's really just the guidelines that have changed. You listed at the top of the hour that many individuals who do not have a pre-existing condition still want to get the vaccine. And they have their reasons, right? They understand their own individual circumstances. They understand those of their family and loved ones in their household. They understand many people want the vaccine because they want to make sure that COVID doesn't put them down when they're going to work. And so the science hasn't changed. And we see a lot of support from our medical associations, including the American Academy of Pediatrics, including the American Academy of Family Physicians and the American College of Obstetricians and Gynecologists, who have broke with the federal government to have broader indications than the ones that you mentioned at the top of the hour. So broader than greater than 65 and broader than anybody sort of between 5 and 64 with an underlying condition.
Let me ask you this. You're a physician, and you probably are too busy to see patients these days, but what do you feel? Do you think people should get the vaccine, even if they are 5 to 64 and don't have an underlying condition?
Clearly, so how I was trained was to follow the science. That was part of really drilled home. When I was a resident, we had to look up, when we were on call, we had to look up what the evidence was for our medical decision making. And again, the science is showing us, and right here in Minnesota, at the University of Minnesota with our Center for Infectious Disease Research and Policy, they reviewed over 600 studies. And it showed sort of the safety and efficacy of the vaccine. And so I still, when I'm with my patients, counsel them about the COVID vaccine. I talk to them about what their fears, their hesitancies are. I talk to them about their family circumstances, really to get a holistic picture around healthcare counseling. And part of, again, to what you said at the top of the hour, many people, still want the vaccine. Right. And I don't think we want to return to those days where people can't get the vaccine when they want it and they feel like it's in their best interest.
Well, the problem is that the insurance payments are linked to the CDC guidelines. And if the CDC guidelines aren't recommending it, then insurance isn't going to cover it. I've checked around. The price without insurance is over $200. I know that the governor has also asked you to work with the Commerce Department to try and see if the access can continue, but that the cost can be eliminated. Is that even possible?
Yes, I mean, I think that is possible. And we are seeing some plans around the country say that they will continue to pay for the COVID-19 vaccine. And so I think there is likely to be the ability for insurance to cover that. I think that is something that is good for population health, good for the care of people. But the executive order really instructs us to sit down with payers and other interested parties to really make sure we understand what their barriers would be to covering the COVID-19 vaccine. Certainly, $200 can be a barrier for real people in terms of household budgets. Absolutely, especially when you're doing a family. Is there any kind of difference between when you look at the guidelines from, let's say the health department comes out with guidelines, the CDC has its guidelines. Could the Minnesota Department of Health guidelines override the CDC? Is that possible, or are they the overall branch? You got to listen to them. So what has happened is the FDA has said that has licensed the COVID vaccine for those defined populations. What we are seeing, which defined populations? For greater than 65 and 565 day deadline condition. But I lift up our medical associations because they set standards of practice also. And so medical associations are lining up with some consistency to indicate that broader access remains appropriate. And so even though the FDA has taken one stance, we'll also see how that rolls into the Advisory Council on Immunization Practices, which will meet next week, and see what they come out with saying, because much of guidance across the nation and statute can refer to ACIP, but we're going to look to see what we can do under the law to make sure people have access. Let me also add, in terms of these deadlines that are coming up, on September 24th, which is the one that is around the corner, it is not so much about defining what is appropriate clinical practice. We see medical associations, again, defining that for us, who are evidence-based and looking at the science and staying up to date. It is really making sure that we think about how do we support our healthcare professionals, how do we support them adhere to those medical guidelines. And what many people are saying, including pharmacists, right, where a lot of people go get their vaccine. I last fall went to the pharmacist for my vaccine. So what we want to make sure is that providers who administer vaccines, including individuals or practitioners who don't have a prescribing license, have a standing order. We're going to explore a standing order, which sort of outlines how you can have an order on place for individuals who meet a defined criteria to go ahead and administer the vaccine to them. And we're going to explore, can we support healthcare providers by developing, again, some best practice protocols, but looking to our professional associations who are grounded in the evidence. What about prescribing it off-label? Apparently, you can still get the vaccine, and you obviously know if it's prescribed off-label. Is that, and that sometimes isn't always covered by insurance. Do you recommend that, or do you hope that you can actually win this guidelines battle? So in terms of prescribing it off-label, that's any time that is not FDA approved, right? Anytime a medicine or therapy is not FDA approved for an indication. And many times within professional practice, for things beyond vaccines, physicians prescribe off-label. I think where you're getting into conflict with the prescription is who can prescribe off-label. Often that is someone like me who's a physician and not someone else like a pharmacist. But again, pharmacies are often the place where people go get vaccines. All right. Basically, it sounds like you and your team are going to work very hard and creatively over the next couple of weeks
to make sure people get access to this vaccine. Do I have it right?
You have it right. We want to create the vaccine access as broad and as accessible as possible. And when people want something, they've talked about it with their doctor, they've got their questions asked, they feel like it's the best for them to protect themselves and their family, we want to make sure they're able to get it. And so it's really protecting access in Minnesota.
All right, bottom line, it sounds like you and the Minnesota Department of Health do not agree with the CDC guidelines as of right now.
I think everybody is having a lot across the country. We are looking at what is coming out of HHS with a lot of concern. And we'll see what happens again with ACIP next week, which is the formal body out of CDC that recommends vaccines. And their meeting is on the 18th. And so we'll see what they ultimately say. But we feel like, again, the data is clear. The science is clear. The benefit is clear. Particularly, I want to lift up for our youngest Minnesotans, those children under 2 years of age. When you look at that group has a high incidence of hospitalization from COVID, and most of those young kids whose immune systems are still developing had no underlying condition. So under the current guidelines, they would not be eligible for a COVID vaccine. And yet again,
and do you think that's dangerous? Do you think that's dangerous?
Do I think what is dangerous?
For them to not have the COVID vaccine, those small babies and toddlers.
Yeah, I mean, the data suggests that their immune systems are still developing, right? The other thing with pregnant women right now, ACOG has come out and said pregnant women should get the vaccine. And part of that reason is so that those antibodies, pass to the developing fetus, right? And so that when babies are born, they already have some of those antibodies. So again, I think when we think about keeping people safe, keeping people free from infectious disease, making sure those of us who are vulnerable in those categories as well, even when we don't have an underlying condition, right, that we go ahead and get the vaccine.
All right. Well, Dr. Cunningham, thank you so much for your time, and we certainly look forward to your guidelines that are coming out very soon, by the 24th of September.
Thank you so much.
And that does it for this edition of Talking Points. Please reach out to me with comments and suggestions at esme@cbs.com. Thank you so much for watching. I'm Esme Murphy, WCCO News.